Good morning. In this video, let us study about the first branch of the trigeminal nerve, that is the ophthalmic nerve. The first branch of the trigeminal nerve, which is ophthalmic nerve. This ophthalmic nerve is purely sensory. This ophthalmic nerve is purely sensory. You can see it is coming from the sensory ganglia. Okay, this trigeminal ganglia. It is purely sensory and it starts from the medial aspect of the anteromedial aspect of the trigeminal ganglia. After piercing the trigeminal cave, which is formed by the dural fold, formed by the dura covering the ganglia. After piercing the trigeminal cave, it enters inside the superior orbital fissure. Enters inside the superior orbital fissure. So this is the trigeminal ganglia here, and this is the nerve which is passing through the superior orbital fissure. This is the superior orbital fissure. This gap is the superior orbital fissure. Then it is found inside the orbit. Then the nerve is found inside the orbit. To study the course and relation of this ophthalmic nerve, we will draw a schematic diagram representing the orbit. So this is actually the superior orbital fissure. These are the orbital walls, the lateral wall and the medial orbital wall. So the medially we also have anterior part of the medial aspect has got the frontal sinus. This is a frontal sinus. Then the anterior ethmoidal air sinus. Then we have middle and the posterior ethmoidal air sinus. Then posterior most we will have the sphenoidal air sinus. Okay, so these are the air sinus which are related to the orbital wall. Okay, this is sphenoidal air sinus, anterior ethmoidal, middle ethmoidal, posterior ethmoidal is the frontal air sinus. Okay, this is the medial wall. On either side of the sphenoid air sinus, we have the sphenoidal, on either side of the sphenoid bone, we have the cavernous sinus. Okay, this is the cavernous sinus, the lateral wall of the cavernous sinus, where the nerves will be passing, will be related to the nerves. The internal carotid artery passes through the sphenoidal air sinus. That is another important thing we should remember. So the internal carotid artery is closely related to the sphenoid air sinus. The ophthalmic division of the trigeminal nerve, is related to the lateral wall of the cavernous sinus. So this is the ophthalmic division which is related to the lateral wall of the cavernous sinus. Below the trochlear nerve, if you see here, there will be trochlear. This is the trochlear nerve. This is the ophthalmic division of trigeminal nerve. After it is, then it passes anteriorly and divides into three branches before entering into the superior orbital fissure, namely from medial to lateral we have the nasociliary, have the frontal, and the lateral most we have the lacrimal nerve. These are the three main divisions of the ophthalmic nerve. Now first we will talk about the lacrimal nerve. So we can open up the orbital wall, superior orbital wall, so that we can visualize the orbit. Now the lacrimal nerve emerges through the lateral aspect. It goes through the lateral aspect and it is found in relation to the superior border of the lateral rectus. So this muscle which is present here is the lateral rectus, and it is present along the superior aspect of the superior border of lateral rectus. So this muscle is lateral rectus. Okay. Now, throughout its course, it is related to the superior aspect of the lateral rectus, and it ends by supplying an important gland here. It's a lacrimal gland. It ends by supplying the lacrimal gland. After supplying the lacrimal gland, some of the branch pass through the gland, and it also supplies the upper eyelid and the conjunctiva of the upper eyelid. It will be supplying the upper eyelid and the conjunctiva. This is a lacrimal gland. This lacrimal gland communicates with the zygomatic branch. Okay, this is actually the zygomaticotemporal nerve of the maxillary nerve. Okay, this is actually branch of maxillary nerve. So it communicates with the zygomaticotemporal branch of the maxillary nerve. We will see in detail how it communicates when we study about maxillary nerve. The next branch is a frontal nerve. Next branch is a frontal nerve, and this frontal nerve is found superior to that of the levator palpebrae superioris. And this muscle, what we are drawing, is actually the levator palpebrae superioris. So this frontal nerve lies on the superior aspect of the levator palpebrae superioris, or we can tell it is found between the periosteum of the eyeball and the levator palpebrae superioris. So this is the course of the frontal nerve. Frontal nerve divides into two terminal branches. One which goes straight, it takes the same course as that of the frontal nerve, that is the supraorbital nerve. So this is actually the supraorbital nerve, and this branch which goes little medially is called supratrochlear nerve. So the supraorbital nerve will enter through a small foramen which is present on the superior aspect of the either a foramen or a notch, okay, which is present along the superior aspect of the superior orbital border, and then it will curve backwards to supply the forehead and the scalp. So you can see this is a superior supraorbital foramen. So this is a supraorbital foramen. So the nerve enters here, the supraorbital nerve enters here, and from here it ascends like this, and it will be supplying the skin over the forehead and the scalp up to the lambdoid suture. So it is almost covering almost 2/3 of the distance of the scalp by dividing into 2 or 3 branches. Okay, that is about the supraorbital nerve. That is about the supraorbital nerve. Now, and along its course, it also supplies the upper eyelid. Here, upper eyelid will be there. So it also gives branches to the upper eyelid and the conjunctiva. So it gives branch to the upper eyelid and conjunctiva, and this branch will be supplying the scalp. Okay. Similarly, so these are all the branches of supraorbital nerve. This is the supraorbital. Next, this is a supratrochlear nerve. Supratrochlear nerve is found over the trochlea. This is actually a trochlea, or a pulley, which is actually guiding the superior oblique muscle. The superior oblique muscle will be taking a turn by guiding through the trochlea. This is actually the trochlea. The supratrochlear nerve goes over the trochlea, so it is present superior to the trochlea. Then after entering, so this is actually the trochlea. This is actually the supraorbital nerve. You can see the supraorbital nerve. Okay, this is actually the supraorbital nerve. Okay, we are using a thread to demonstrate the supraorbital. Now, supratrochlear will be found medial to it. This is the trochlea. Okay, it will be coming through this region and it will be supplying the forehead. It will be supplying mainly the forehead and the skin over the root of the nose and also the upper eyelid. It also supplies the upper eyelid and conjunctiva. So, it also supplies the upper eyelid and conjunctiva. Okay. So, it supplies scalp, conjunctiva and upper eyelid. So that is about supratrochlear. So this is the supratrochlear nerve. Next we will study about the third nerve. Before that we will draw the optic nerve. So this is actually the optic nerve. This is actually the optic nerve. This is a little deeper structure. And we will draw one more muscle, the superior rectus. Okay, the superior rectus, which will be here. So this is actually the superior rectus muscle. So this nasociliary nerve, initially it is present found between the optic nerve and the lateral rectus. Then it goes over the optic nerve and it is found deep to the superior rectus muscle. Then it is found deep to the superior rectus muscle to go to the medial wall, of the orbit, Here it terminates by giving anterior ethmoidal branch. And the infratrochlear nerve. This is actually the infratrochlear nerve. So if you study about the infratrochlear nerve, this infratrochlear nerve will be supplying the lower eyelid, the lower part of the eyelid's conjunctiva of the lower eyelid and the conjunctiva, and also it supplies part of upper eyelid, okay, on the medial aspect of the upper eyelid. And this also gives branch to the lacrimal sac and the lacrimal caruncle. So this also gives branch to the infratrochlear also gives branch to lacrimal sac. Okay, so that is about the main branches of the infratrochlear nerve, and this infratrochlear nerve communicates with that of the supratrochlear nerve by a communicating branch. So the infratrochlear nerve communicates with the supratrochlear nerve by a communicating branch. Okay, that is about the first terminal branch of the nasociliary nerve. Okay, that's the infratrochlear nerve. Next, coming to the anterior ethmoidal nerve. This anterior ethmoidal nerve takes a very complicated course. During its course, it supplies the anterior ethmoidal group of air sinus, and it also supplies the middle ethmoidal air sinus. Then it ascends anteriorly and it is found here on the crista galli, on relation to the crista galli along the cribriform plate of the ethmoid, and it pierces. There is a small opening in front of the crista galli, so it passes through that to enter into the nasal cavity. So once it reaches near the nasal cavity, it also supplies the upper part of the nasal septum and also the lateral wall of the nose. Then it emerges out and ends by supplying the skin over the lower part of the nose. So it is going to supply the upper part of the nasal septum and the lateral wall of the nose and also the skin over the lower part of the nose. So this branch passes all the way and it will supply the nose, mainly the nasal septum, lateral wall of nose, skin over the lower part of the nose. Over lower part of nose. Okay, these are the areas supplied by the anterior ethmoidal branch, the anterior branch which is coming from the anterior ethmoidal branch. Okay, that is about the anterior ethmoidal nerve. So two terminal branches are over. Next we will study the rest of the branches of the nasociliary nerve. To understand the rest of the branches, we need to know about the sympathetic plexus. So this is the superior cervical sympathetic ganglia. Just consider this as the superior cervical sympathetic ganglia. The postganglionic fibers from the superior cervical sympathetic ganglia will form plexus around this internal carotid artery. So from the internal carotid artery, the plexus will follow the nasociliary nerve. It will follow the nasociliary nerve. So from the nasociliary nerve, and these plexus, I have marked it black over the fluorescent color, these plexus will enter through the long ciliary nerves. There may be 2 or 3 long ciliary nerves, and these long ciliary nerves will pierce the eyeball around the optic nerve, the sclera of the eyeball, and it will be traveling between the sclera and the choroid. It will be traveling between the sclera and the choroid to supply the dilator pupillae. So only the sympathetics which are going through this is going to supply the dilator pupillae. So these sympathetics are supplying the dilator pupillae. So other than the sympathetics, this long ciliary nerve which are coming from the nasociliary nerve will be giving the sensory fibers, will be giving the sensory fibers to the cornea. It will be giving to the iris and to the ciliary body. So if you take, this is the eyeball, this is the cornea, this is the iris, and this is the ciliary body. So it will be traveling all around, and it will be giving the sensory fibers to all these structures, including the cornea through this. Okay, that is about the nasociliary nerve, the long ciliary nerves. Next we have short ciliary nerves. So here will be the ciliary ganglia between the optic nerve and just at the proximal part, okay, the proximal part, just medial to the optic nerve. And this ciliary ganglia is connected via a sensory route, through a sensory route to that of the nasociliary nerve. It is connected by a sensory route to the nasociliary nerve. From here, we have multiple short ciliary nerves. And these short ciliary nerves will receive the sensory inputs from the cornea, iris, and the choroid. Okay, it will be receiving the sensory impulse from the cornea, iris, and choroid. So it is going to get sensory inputs from cornea, iris, choroid. That is about short ciliary nerves. And the these sympathetics also pass via the short ciliary nerve to supply the blood vessels. The sympathetics which are forming the plexus here also will be coming from the plexus here, also will be traveling via the short ciliary nerves to supply the blood vessels. So that's all about the branches. Once again we'll summarize. So the ophthalmic division is found in relation to the lateral wall of the cavernous sinus. From there it divides into 3 branches. The lateral most branch is the lacrimal, then middle is the frontal, then the nasociliary. First coming to the lacrimal branch, branch is found on the superior margin or the superior border of the lateral rectus. From there it goes and supplies the lacrimal gland, and also crossing the lacrimal gland it also supplies the upper eyelid and the conjunctiva related to the upper eyelid. It also communicates with the zygomatico-temporal branch of the maxillary nerve. Okay, this is about the lacrimal nerve. The next is the frontal nerve. Frontal nerve is found superior to that of the levator palpebrae superioris. Then it divides as terminal branches, the supraorbital and supratrochlear. Supraorbital and the supratrochlear will be supplying the scalp and conjunctiva of the upper eyelid, and the supratrochlea will be found superior to that of the trochlea, which is actually helping. The trochlea will be guiding the superior oblique muscle. Okay, next it also the supraorbital nerve will be communicating with that of the supratrochlear nerve will be communicating with that of the infratrochlear nerve, which is actually a branch of nasociliary nerve. Then coming to the last branch, that is the nasociliary nerve. Nasociliary nerve is the medialmost branch, and it is initially found between the lateral rectus and the optic nerve. Then it crosses the optic nerve. Then it is found deep to the superior rectus muscle, and it ends by terminating into two terminal branches, that is the anterior ethmoidal and infratrochlear nerve. This infratrochlear nerve will be supplying the frontal air sinus, it will be supplying the lacrimal sac, it will be supplying the lower eyelid and the conjunctiva, and also the upper eyelid. Then coming to the anterior ethmoidal branch will be supplying the anterior and the middle ethmoidal air sinus. Then anterior branch which goes and supplies the nasal septum, lateral wall of the nose, and the skin over the lower part of the nose. Then there is one more branch, that is the posterior ethmoidal branch. The posterior ethmoidal branch will be supplying the posterior ethmoidal air sinus and also the sphenoidal air sinus. So that one we didn't tell. There is a posterior ethmoidal branch which will be supplying the posterior ethmoidal air sinus and also the sphenoidal air sinus. And then coming to the branches which are coming from the beginning, from the start, is the short ciliary nerves and the long ciliary nerves. Short ciliary nerve is found in connection to that of the ciliary ganglia. It will be getting the sensory impulse from the cornea, iris, and the choroid. Then the long ciliary nerves, which will be actually carrying the sensation of the cornea, sclera, and the iris and the ciliary body. And the sympathetics which are passing through the short ciliary nerves will be supplying the blood vessels of the eyeball. Then the sympathetics which are passing through the long ciliary nerves will be supplying the dilator pupillae. The last one, actually the supraorbital nerve will give one small branch which will be supplying the frontal air sinus. So that one we missed. The frontal air sinus is supplied by the branch coming from the supraorbital nerve. The supraorbital nerve is supplying both the frontal sinus and the scalp and the forehead. The pain of the frontal sinusitis will be referred to the forehead. That is why we experience pain on the forehead while we have frontal sinusitis. These are all the branches of the ophthalmic division of trigeminal nerve. Thank you.